Hi everyone, it's Tova, and today I'm breaking down vaccine equity. So recently, headlines in the US and other high-income countries have been optimistic about the COVID-19 pandemic. As more and more people are getting vaccinated, cases and deaths are dropping rapidly, and more places are opening up. However, at the same time, many other countries are seeing rapid growths in cases and difficulties accessing the vaccination. This has sparked a major debate about COVID-19 equity, who should get the vaccine first, and what responsibilities higher income countries have to vaccinate the rest of the world. Now, let's look at India. Currently, they've been seeing record-breaking amounts of positive COVID-19 tests, hundreds of thousands a day, including over 400,000 on Wednesday. Many of their hospitals are past capacity and are turning people away who desperately need medical care. There are shortages of oxygen, which is needed for COVID-19, a respiratory disease. Up until now, India had been doing relatively well in COVID cases. In January and February, cases fell to under 200,000 daily in a country of over 1.3 billion. The government of India believed that the virus had been beaten and opened up all public gathering places. Many crowded religious festivals were also allowed to continue. However, due to the relaxed restrictions and the spread of more contagious variants, cases have skyrocketed recently. Many experts also say that India has a very inequitable and broken healthcare system. While rich Indians have been able to access top healthcare facilities, most poor rural people have extremely low access to high-quality healthcare, and many hospitals were already struggling before the pandemic. Of course, this is not by any means unique situation to India. Many countries, including the US, face the exact same challenges in health equity. Now, the Indian government and healthcare experts are turning to vaccinations to try to slow the pandemic and save lives, since they worry about the catastrophic economic impact that more shutdowns would have on India's poor. The Indian government originally set a goal of 300 million vaccinations by July, but are having a lot of difficulty accessing enough supply of the vaccine to reach that goal. Only 130 million people have received their first shot, and 26 million people have been fully vaccinated so far. Remember, their population is 1.4 billion, and they need 615 million doses to vaccinate everybody over the age of 45. Meanwhile, in the US, there are more doses of vaccine than people to give it to. Our rate of vaccinations is slowing, as some people refuse to get the vaccine. According to the New York Times, 20% of American adults say that they'll refuse the vaccine, and this has led many to urge the US and other higher income countries to share their vaccine supply. The Biden administration has promised to share up to 60 million vaccine doses of the AstraZeneca vaccines with other countries in response to the Indian crisis. They've also sent India enough raw materials to make up to 20 million doses. Also, Biden, under public pressure, now supports a temporary patent waiver for the COVID-19 vaccinations, which would allow countries to locally produce vaccinations, increasing the worldwide rate. This proposal is being discussed by the World Health Organization, and they'll most likely rule this week or early next week. More broadly, these crises raise larger issues. How much will the world be able to or will be willing to work together to solve the COVID-19 crisis? How can we overcome inequity between high and low income countries and within countries, like we're seeing in the US, or between different racial groups, etc.? What responsibility do high income countries have to share their resources and money with other countries? Will we be able to tackle this crisis together, or will our inability to coordinate a unified response lead the pandemic to spiral further?